Hey, hello everybody, this is Dr. Cam Yuen. I just want to say something about injuries, physical injuries. If you have chronic or acute severe injuries, those could be resolved, right? So it will be resolved and not a question about whether it could or could not be. So it could be any injuries. It could be injury to your knees and hips and shoulders, arms and the foot, toes and hands and finger and wrists. So even brain injuries. So actually brain injuries is not that complicated to resolve it, because the brain and the rest of your central nervous system is the smartest portion or the smartest part of your body. So you want anything to resolve, you want that physical intelligence of that smartest part of your body is going to resolve the injury. So if you have a brain injury, it's actually the rest of the central nervous system are going to process that and put all the weakness in the right order and allow those weaknesses to strengthen themselves. It is that simple that no one give any credence to it, but it's really the results, the immediate results. So it's not like, okay, you do things and then you wait days and weeks or even months to have some recovery. That should not happen even for injuries, right? So the difference between a chronic injury and acute injury, the acute injury means that there's a few more things that you have to stabilize it, with a chronic injury, because the time element, it actually stabilizes itself by itself, actually. So and that's so it's an easy thing, right? So chronic is actually easier to resolve than acute. So, and you could do over the phone, right? It's not something that you have to touch it and give treatment for and therapy. So the next few seconds, you would know you improve or not, right? So there are people that are scheduled for knee surgeries, and during the lunchtime, actually a couple of minutes during the lunchtime, their injury or their pain or their instability of their knees or one knee will change very quickly. Even if they schedule for surgery, they could actually, the next minute or so, they could actually squat and jump and things like that. So I am doing a fundraising event, actually for retired NFL players. So I have spent some time in, well, not that much time, resolving their chronic injuries. Some of them have it for decades. And football injury is kind of worse than normal injuries, right? So there's no such thing as normal injury, but make the comparison. If you get beat up or you got somebody traumatize you, well, it's more of an injury than if you traumatize yourself. So again, I want to say something about the brain injuries. There's no intelligent connection how to resolve it. They're just going to take an MRI and tell you, well, you have a problem with your brain, and that's about it, and there's nothing could be done about it. Well, that's true. The conventional approach cannot do anything about it, and it's not about healing or treating. It's about processing the situation in the right order of weakness. When you put the weakness in the right order, your physical intelligence or central nervous system will just strengthen each one of those weaknesses in the right order. So anytime you have an injury or you have anything that troubles you or affects you, it will show up as a weakness for you. It will weaken your muscles, to weaken your body. But if it weakens your muscle, then it's easy to perceive that weakness or those weaknesses. But nevertheless, it's about the central nervous system connecting with the feeling, perception, and intuition and have the insight. So insight is totally physical. See, most people misinterpret it to say that feeling, perception, intuition, those are mental or spiritual quality, but it's actually physical. So it comes from the central nervous system. So when we could utilize the central nervous system more, then we could resolve things. It's really the central nervous system will connect with the injury, and the injury connect back to the central nervous system. And you want anything improve or have a faster recovery, it comes from the central nervous system. It doesn't come from elsewhere. It doesn't come from the therapy or whatever you do to it and try to speed up the recovery. So when the weakness is identified that caused by the injury in the right order, when I say in the right order, you could injure your tendons, your ligaments, or your fascia, your connective tissue, or even your bones. When you could make a comparison and put it in the right order, it actually goes away, right? So I'm not healing anything, I'm not doing any therapy, but I will, you and I will improve the effectiveness of people that give therapy or treatment to others. We can make it more efficient, more effective, and faster recovery, right? So I'm not here to destroy anyone's therapeutic, what they call practice, but therapeutic business, right? So I'm not in conflict with them. I just want to enhance that their treatment, so things will recover so much quicker. So you have to see it, right? You have to experience it. So I would schedule a fundraising event, and also I would schedule a teleclinic for people that have injuries. So and of course the fundraising event that I was presented and demonstrated, I would demonstrate it on the first 10 people that enroll, right? So I'm not gonna try to resolve hundreds of people at the same time, but in a total clinic I could do that, because then we could spend more time together to make that immediate, so it would be no debate or argument about it. So thank you so much for listening. Okay, take care. Bye.